Let me tell you something that will immediately lower your NCLEX anxiety. You do not need to get every question right to pass the NCLEX. In fact, you are expected to miss questions. In this video, I'm going to explain exactly how NCLEX is scored, how computer adaptive testing works, and why struggling on the exam is actually a good sign. The biggest NCLEX myth. Here is the biggest lie nursing students believe. If I keep missing questions, I'm failing. That is not how the NCLEX works. NCLEX is not a percentage test. There is no 75%, no 80%, no passing score you can calculate. NCLEX measures one thing only. Are you a safe, entry-level nurse? What is computer adaptive testing? The NCLEX uses something called computer adaptive testing, or CAT. That means the exam adapts to you. When you answer a question correctly, the next question gets harder. When you miss a question, the next one gets easier. This does not mean you're doing bad. It means the test is finding your level. The goal is not to trick you. The goal is to see if you can stay consistently above the minimum safe nursing level. What is the passing standard? The passing standard is not a score. It is a line. Above the line equals safe nurse. Below the line equals unsafe nurse. NCLEX keeps giving you questions until it is statistically confident where you fall. That's it. No perfection required. How the NCLEX decides to stop. There are only 3 ways your exam ends. 1. Confidence rule. If NCLEX is 95% confident you are above the line, you pass. If it's 95% confident you are below, you fail. 2. Maximum question rule. If you reach the maximum number of questions, NCLEX uses your final ability estimate. Many people pass at max questions. 3. Time rule. If time runs out, NCLEX looks at your last answers to see where you landed. Time running out does not mean automatic failure. Why Next Gen NCLEX is actually fairer. Here's the good news about Next Gen NCLEX. NGN uses partial credit scoring. That means multiple response questions are no longer all or nothing. You earn points for correct clinical thinking. If you pick 3 correct answers out of 4, you still earn credit. This rewards reasoning, not guessing. Why the exam feels hard, and why that's good. Here's something most students don't realize. If the exam feels hard, you're probably doing well. NCLEX becomes difficult when you are near the passing standard. Easy questions usually mean the test thinks you are below the level. Difficulty is not failure. It's the exam doing its job. How this should change your test day mindset. Here's how smart test takers think. They don't count wrong answers. They don't try to predict their score. They focus on one question at a time. They ask, is this action safe? Does this address the most immediate risk? That mindset keeps you above the line. The NCLEX is not measuring perfection. It's measuring consistency and safety. Subscribe, turn on notifications, and comment. I'm calm and prepared.